Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Abnormalities. The abnormalities due to the loss of or the gain in mutations, and this is of the GPCR and or the G proteins. So the first one is the receptor GPCR. So we look at the conopsins. So the conopsins, the mutation is there is a loss. Conopsins, the mutation is a loss, and the disease caused is the color blindness. Then is the rhodopsin. The rhodopsin again is a loss, and there is a congenital night blindness. There are two forms of retinitis pigmentosa. There's two forms of this RP, that is a retinitis pigmentosa. Next is the V2 vasopressin. So V2 vasopressin, the type of mutation is there is a loss, and the disease is there is a X-linked nephrogenic DI, that is a diabetes insipidus. Then comes ACTH. ACTH, the type of mutation is nothing but there is a loss, and it can include the familial glucocorticoid deficiency. Now moving on to the TSH. The TSH, it also results in the loss, and this loss is it can lead to the familial hypothyroidism. Then thromboxane A2. So what does the thromboxane A2 do? Thromboxane A2, it can cause a loss, and it results in the congenital bleeding. Then comes the endothelin B. So endothelin B, it again causes loss, and it results in the Hirschsprung disease. The Hirschsprung disease. Now, what is the LH? LH, it causes gain. So whatever we are discussing now causes gain. The LH causes gain. There is a familial male precocious puberty. Next is the TSH. The TSH, it again causes a gain. That is a familial non-autoimmune hypothyroidism. Familial non-autoimmune hypothyroidism. Next is the calcium. So in case of calcium, there is again the gain, and it results in the familial hypercalciuric hypocalcemia. So familial hypercalciuric hypocalcemia. So TSH was the gain, and it is a familial non-autoimmune hyperthyroidism. Now calcium. So calcium, as we saw, it was a gain and causes a familial hypercalciuric hypocalcemia. Now let's look at the G protein. So G protein, there is a GS alpha. So GS alpha, there is a loss, and it leads to the disease associated is a pseudo hypopara. So pseudo hypopara thyroidism, pseudo hypoparathyroidism, and this is nothing but the type 1A. Next is the GS alpha. So GS alpha, it causes the gain and the loss, and what is involved? It is a testotoxicosis, TT, testotoxicosis. Then the GS alpha, again the GS alpha, the gain that is a mosaic. So this results in the McCune-Albright syndrome, so we call it the MAS. Then next, the GS alpha. The GS alpha, the gain, it can lead to the somatotroph adenomas with the acromegaly. Now moving on to the G1 alpha. So what happens in the G1 alpha? The G1 alpha, there is a gain, and it leads to the ovarian adrenocortical tumors. Ovarian adrenocortical tumors. To learn and grow daily like this, please do subscribe.